Hi, everybody. Thanks so much, Eve. That was very kind of you. So I very much appreciate the opportunity to participate here today. In my 24 years as a community health nurse, I've observed the very profound impacts that the environment and climate change have on our health and well-being. I'm honored to share a couple of stories and my experiences with you as we celebrate the urgent and historic action taken by the EPA and the Biden administration for rules against carbon pollution. So when I completed my nursing education at Arizona State University, I can clearly remember the home health visits I made for patients with chronic lung disease. I saw maybe one or two patients a day with these conditions. I then worked as a school nurse and eventually returned to working with seniors with long-term needs. And now in a given week, the number of seniors I see with lung disease has easily tripled. When my alarm goes off in the morning, I don't necessarily reach for social media or email. Instead, I check the apps that describe the air quality and pollen count because I'm planning on protecting my patients from the very air we all breathe. When I observed a pattern of increasing air pollution on the health of seniors, I looked for support from the nursing community to process my experiences. And that's when I discovered the Alliance of Nurses for a Healthy Environment. We also call it ANNE. So I'm very grateful and proud to belong to a nationwide group of talented nurses who understand the relationship between human health and the environment in which we live, work, and play. ANNE promotes nurses into pivotal roles in environmental health because we are indeed the frontline workers that support people suffering with the effects of pollution. ANNE organizes nurses' activities through four main initiatives or forums. They are education, practice, research, and policy/advocacy. Now, my favorite forum to engage with is the topic of policy and advocacy, and this combines the previous three forums and activates nurses into environmental policy at the state and federal levels. Through ANNE's Policy and Advocacy Forum, I've been able to collaborate with other medical providers by directly speaking to lawmakers. At the Arizona State Capitol, and as well as Capitol Hill in Washington, D.C., I take my experiences of caring with seniors to the people who create our public health policy. And I specifically ask that clean air, water, and soil become the policy priorities for our collective health. So when I advocate on the intersection of environmental and human health, I talk about what I see in my patients' homes. For example, I can explain how I care for Hispanic elders in neighborhoods adjacent to industrial work sites in the south side of Phoenix, where the air has a pungent taste and smell. The sky isn't entirely blue, it's actually an off shade of tan. Now, the elders I see in these neighborhoods are frequently short of breath, and they cling to the hope that this oxygen tubing they're attached to will deliver much needed relief. I describe the physical challenges of very hot Phoenix summers. I see seniors in suburban and rural communities struggle with increased heat cycles that cause longer pollination seasons. This increased pollen causes more allergies, more inflammation in already compromised lungs. Their noses don't stop running. Add ozone or soot pollution from increased traffic and lung conditions worsen. Eventually, cardiovascular disease will develop from the strain of poor lung function. I often care for seniors on fixed incomes who struggle to pay their utility bills for cooling their homes. I've entered patients' homes in the morning to find seniors exhausted and dehydrated from nights that never dropped below 90 degrees for days on end. Dehydration is exponentially dangerous to seniors due to the added strain that their multiple medications can have on their kidneys. Extreme heat is a huge burden to our seniors' health and all of our health. Additionally, we know that drought raises the cost of nutritious fresh foods. So the combination of increasing food costs plus medications like expensive inhalers, it's just too much for seniors on fixed incomes to afford. Physical conditions worsen, and then supplemental oxygen is needed. That leads to decreased mobility, and exercise becomes nearly impossible. Well, decreased exercise and mobility then leads to metabolic conditions such as diabetes, not to mention increased social isolation. And we all know that social isolation leads to poor mental health. So these examples reveal a direct connection of poor air quality, increased heat, and drought to our worsening health and well-being outcomes. I bring a very simple message. Nurses rely on strong environmental protection policies like the recent EPA rules to assist us in preventing more human suffering. We must remain diligent in urgently enacting these rules so we can all celebrate together a very long and happy life in good health. So on behalf of Annie, I thank you for including my nurse perspective in this important discussion, and I celebrate the EPA and the Biden administration for responding to the very important needs of our seniors and our environment.